Please give him a round of applause so we can start this presentation.
Thank you so much for the presentation. It boosts my morale. So I will start by saying that it's a great pleasure for me. It's a privilege to stand here today to speak to you about stroke. Why stroke? Stroke is a subject that causes every year thousands of deaths. And mostly, I went through a brain hemorrhage 4 years ago. And since then, I said to myself, what can I do to help others minimizing the risk of stroke? Also, I want to let you know I'm not a doctor, I'm not a health professional, I'm just an individual who has made some proper good research to help others. And I will also say, for those who are expecting to hear English grammar or a Queen English today, you won't get it. I'm just a French speaking who will try to express myself in English. Thank you so much. And really, I would tell you, if you listen to what I'll be saying here today, without any doubt, you will reduce your risk of stroke. I will be answering few questions. Those questions are, what is stroke? What are the different types of stroke? How to minimize the risk of stroke and stroke symptoms. Now, we speak about stroke when one part of our brain is not receiving blood anymore. So, when there's a sudden stop of blood going in one part of our brain, then we speak stroke is happening. And the part not receiving the blood, there the cell starting to die, and then the first symptom will start appearing. Now, as I said, when the blood is not going in one part of the brain, that part is not having glucose, nutrient, and then symptoms start. What are the type of stroke? We have two main types of stroke. The first type is called ischemic stroke. The ischemic stroke is when there's no blood spilled in your brain. There's no blood at all. That is called ischemic stroke. Now, why does it happen, this ischemic stroke? We have few reasons. The first reason of ischemic stroke to happen is when the blood clots going from your heart will travel up to your brain. Now, why does this blood clot form itself in the heart? It's when you have palpitation or your heart is beating irregularly. If you have palpitation and your heart beating irregularly, seek advice, talk to the doctor. When your heart is not beating regularly or you have palpitation, the heart is not pushing enough blood, and the remaining blood in your heart, there will form the clot that will go into your brain. Okay, that's the heart beating. You can see that the little clot going up to the brain is traveling, and because the blood vessels are too tiny, those clots at some point will not be able, that clot will not be able to travel anymore. It will block. You see, the clot is there, is going, and then as the blood vessel is getting tiny, it blocked there. And then you can see now it's coming dark. The cells are starting to die. So that's the first reason why stroke happen, blood clot. Now, okay, sorry, I have some notes, okay, to make sure I don't forget anything. Okay, don't say this man don't know anything. So, it's to make sure I have everything for you. So, also, irregular heartbeat is very, very dangerous. That is also why stroke happens. This is how your heartbeat. You see, this is regular. That's your heart beating. That's the same thing, same pattern. But if your heart beat this way, kind of disorder, it should beat regularly. Look. Then if you also follow the same pattern, then we speak about irregular heartbeat. Also, we have what is called atherosclerosis. With the time passing, or when we eat like fast food, all this bad cholesterol, something formed in our blood vessel, kind of fat. So you have the blood vessel. Between the layer of the blood vessel, the fat will form. And when this fat form in the blood vessel, in this layer, you see it get big. The first one is the blood vessel, it's clear. Now you have this bomb here, that is the fat. With the time when the fat form in our blood vessel, it get big, and you can see it's obstructing now the passage of the blood. It may burst out, it may just explode. When it explodes, the little particles that are inside those fat, it may travel as well in the blood, go to the brain. It's called plaque. Plaque are all these fatty things that has formed in that blood vessel. Then it will go now into your brain because the blood vessels are too tiny. They will block somewhere. Then the blood can go through. Then you'll be starting making stroke. We have also what is called thrombosis. So you have the blood vessel.
Between the layer of the blood vessel, a fatty blood will form in the sac, preventing the blood to go through fluently.
It gets big, and you can see it's obstructing now the passage of the blood, who will cause as well the blood not to go through fluently, and then stroke may happen. Okay, so now we have spoke about the thrombosis, about the clot, and about the plaque. We have also what is called brain hemorrhage. That's the stroke that I went through. In the case of the brain hemorrhage, here is when the blood spilled out, when the blood spilled in your brain. When we speak about brain hemorrhage, is when the blood vessel bursts out and the blood spilled in your brain. So this is the first type of brain hemorrhage. It's called intracerebral. Then the blood has spilled inside your brain. You have also what is called extracerebral hemorrhage. In that case, the blood will spill between your brain and your skull. You can see the brain is there, you have your skull up there, and then you can see the blood between these two. That is called now extracerebral hemorrhage. So these are the two types of hemorrhage that we have who can happen within our brain. Now, what are the causes of brain hemorrhage? The cause of the ischemic stroke we spoke earlier can be applied to brain hemorrhage as well. The thing is that in the first type, the ischemic, those causes happen, but the blood vessel doesn't burst out. But when you put the clot, you put the plaque, you put all what we spoke before, when this thing now happen, it will block the blood vessel, and then the pressure of the blood trying to pass through, it won't happen. What will happen, the blood vessel now will burst, and the blood will spill out. So that's why the cause of the ischemic stroke can be applied at the hemorrhagic stroke. So one of the main causes of the stroke is the high blood pressure. We call it silent killer. So how many people around us check the blood pressure? Very little. So blood pressure is something that I will be talking about it. I have a short video of 3 minutes to show you really how to take your blood pressure, what is the danger to ignore it. As I'm going through, I will come back. So the blood pressure is what is it? When our heart beats, it pushes the blood in our blood vessel. As it pushes that blood, our blood vessel expands to let the blood go in through. That is the top number. That is called systolic number. And when the heart relaxes, the blood vessel closes again. That is the lower number. And the good number, diastolic, and the good number should be 120/80. That's the best one. When you are in this number, there's nothing to worry about. It's when your blood pressure now go over 140/90. So 140 systolic, which is the top number, over 90, which is diastolic, the lower number, then you will start seeking eventually medication. And then when it's over 140/90, then we can say you are going to hypertension. So I will advise really everyone, if they can, to have the blood pressure machine at home. That's one of the best things to do to avoid stroke. I say at home, why? Because when the doctor takes your blood pressure, it may not be right. There are some people who panic, like me. If I sit in front of the doctor, they take my blood pressure, it will be 190 over 100. And I'm sure it's wrong. I will tell you, I even tell my doctor, don't bother take my blood pressure. It will be wrong. Because it's called white coat syndrome. So when you sit in front of the doctor, he take my blood pressure, it won't be right. So that's why now he sent me to the nurse to take my blood pressure. The nurse is someone normal, just like me. Then it was normal, 125 over 85. Yes, but scared of the doctor. Oh, what will happen? What will happen? So now, when I take my blood pressure at home, it's always very good because I'm relaxing, I'm scared of no one, but it's not for everyone. Some people come to the doctor will be okay because I'm not panickers. Some people panic. Me, I'm panic easily. So. Okay. Now I will show you quickly, please, how to the machine about the blood pressure. So this one is a monitor, the one that will read the blood pressure. So this part is the one that will go on the arm to feel the blood pressure. Okay. So this part is going now on the arm. They put it here like this, and then we make sure that the pipe stand here where we have the main blood vessel, and then we turn it to hold it. See, it should not be too tight, and it should not be neither too loose. Let us tighten a bit more. We will power on the machine. Here we have the reading of 142 over 89, which is quite high. Sometimes the first reading is not the best because the patient or yourself with your blood pressure may be a little bit anxious. That's why I will recommend to take always 2 or 3 times. Let us start again. As you see, now it has gone a little bit lower. Now it's 124 over 86. Still a little bit higher because the best one should be 120 over 80. It's still okay. There's nothing to worry about here. It's a good reading, but let us give a last go. So this part is really important to have your machine, take your blood pressure at home and check it. Okay? So we have now the same. We see the first one was high, simply because the first take may be a little bit high, and it's not the right one. Because you're a bit anxious, what will the reading be? And then it can be wrong. But when we take the second and the third time, that you will see that is the same. So here we have 125 over 86. We're still very good, to be honest. But now, it's when you go over 140 over 90. So if the systolic, which is the top one, is over 140, and the diastolic, which is the bottom one, is over 90, then we can say you have hyper blood pressure. Then you may need medication. Another cause of brain hemorrhage is called aneurysm. Aneurysm is what? It's something very common when you come to brain hemorrhage. Sometimes you see this ball, kids are playing with the old ball. On the side, you have a kind of bomb. Or the old car tires, they make on the side kind of little bomb on the side. So this bomb on the side, you can see that's a blood vessel, and on the side you have that bomb which is not supposed to be there. It's for some reason that I don't know why it happened. And then under the pressure of the blood going through, it pushes it, and then it just bursts. Or if you have a high blood pressure, or you stress or whatever, your blood pressure goes high, then it will burst and you have the blood in your brain.